Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and we're going to talk about what is bursitis. So everybody's heard the term bursitis and just says, my shoulder's sore, that's bursitis, but what actually does that mean? What is a bursa? So let's start with the term itis. So itis in Latin means inflammation. So I have tonsils, I get tonsillitis. I have an appendix, I get appendicitis. I have a bursa, I get bursitis or inflammation of the bursa. So we'll look at the elbow because that's a relatively straightforward joint. So your elbow's got this little pointy thing at the bottom, and if you moved your arm up and down all day long, you would wear a hole through the skin because of that friction from the arm bone. So your humerus, the upper arm, and then the ulna has this little pointy thing down at the bottom right there. That's the tip of your elbow called the Olecranon, okay? So what a bursa is, think about a little Ziploc bag with just a couple of drops of oil in it. So if you put the Ziploc bag with oil, it's very flexible and very slippery, and you could do that all day long and it wouldn't wear a hole in the bag. So that's what a bursa is a little mini Ziploc bag with just a little bit of synovial fluid or oil in it as a lubricant. So when you're moving your arm up and down, it's that bursa that slides side to side and it doesn't cause irritation of the skin. When you get bursitis, that's inflammation in that bursa. So think of your little Ziploc bag with oil and add some sand to it, and that would be gritty and crunchy, and that's what bursitis is, and that's why it's very painful. You can get inflammation and actually fluid in it, so take that Ziploc bag and put some water in it, and now the joint is swollen. That's what the doctor might drain. So you have bursas all over your body. You've got multiple bursas in your shoulder that protect tendons from rubbing on the bone and bone rubbing on soft tissue. You have them in your elbow. They're literally all over your body. So that's a very generic term, but it has a very specific meaning. When the doctor treats this bursitis with an injection, they actually go in to the little Ziploc bag and either pull fluid out of it to take away the excess fluid, or they'll squirt a little bit of cortisone in there to take away the inflammation. The only caution I would give you is that with the elbow in particular, because there's really not a lot of tissue above that little Ziploc bag, sometimes when we stick a needle in there, the thing continues to drain, and then you actually have a chronic draining fluid from that knee or elbow, and you need to actually have surgery to close that. So other joints in the body are covered by fat and muscle tissue, so they make a nice seal, but the elbow in particular, I would be very careful when you get this golf ball size swelling. It seems like it makes sense to stick a needle and drain it, but I would do everything else before that. So bursa is a Ziploc bag, lubricant over any rub or wear point in the body. Bursitis is inflammation of that little Ziploc bag of fluid. Dr. Greg Castello, thank you.